Hello, my name is Savannah Pendergraft, and I have chosen to discuss choice number 2, the temporomandibular joint. The main function of the temporomandibular joint is to facilitate motion in the lower jaw, and it is located inferior to the temporal bone of the skull and superior to the mandible on the lateral aspect of the face. In this illustration, I will show and describe the temporomandibular joint and its articulating surfaces. It is a synovial joint composed of two articulating surfaces: the articular tubercle of the temporal bone and the mandibular condyle. These two surfaces are separated by an articular disc that reduces friction between articulating surfaces and stabilizes the condyle of the mandible. The surfaces are lined by fibrocartilage. I will now demonstrate the different movements that the temporomandibular joint allow. This is depression of the mandible. This is elevation of the mandible through contraction. This is the retraction of the posterior side of the mandible. And this is protraction of the anterior side of the mandible. An individual with a dislocated temporomandibular joint would complain of pain when chewing, elevating or depressing the mandible, and trouble talking. Someone with this type of injury may present with pronounced retraction or protraction of the mandible and may not be able to fully contract their mandible. Temporomandibular joint dislocation can occur due to trauma of the mandible, opening the mouth too wide when yawning or eating, clenching or grinding of the teeth, or excessive strain on the joints.